Okay, at this point, we have covered the entire axial skeleton. So we have 80 bones knocked out. You've covered a total of 80, and we have 126 left in the appendicular skeleton. So let's get started. First, we're going to begin with the upper extremities, basically the arm bones, and then we'll do the hips and leg bones last. First bone we're going to introduce is what connects the sternum to your upper arm area, and that's called the clavicle. In layman's terms, you may have heard it referred to as the collarbone, right? But we definitely need to address it as the clavicle. And what we're going to do in just a second is we're going to combine it with our shoulder blade bone, called the scapula bone. And what that's going to do is form a very important joint called the AC joint. And what that stands for is the acromioclavicular joint. The acromion is just this tiny little piece of the scapula. I'll try to point to it for you. There we go. This area right here. And you can feel this on your own shoulder. Basically, just the outside of your shoulder. You kind of just trace your collarbone and then work it all the way to the very, very outside part, and you'll feel this bump. And that's where the acromion process and the clavicle kind of meet, and also known as the AC joint. And when you put these two bones together, they form what we call the shoulder girdle, also known as the pectoral girdle. And this is what allows you to move your shoulder joint. So if you were to ever sprain or dislocate this joint, you'd have a very, very hard time actually moving your arm. So here are the scapulae. Scapula, if we have one bone. These are also known as your shoulder blades. And as I mentioned before, now you can really, great picture, you can really see the acromion process. This structure right here, just this tip, is the acromion. And then wrapping around in the front, that I'll highlight in purple, is the clavicle. So you can really get an appreciation for that AC joint right there that actually makes your shoulder girdle. And here you go. Shoulder girdle, once again, also known as the pectoral girdle, but it's just this combination of these two bones that allow us to move our arm, move our shoulder. All right, a few scapula bone markings that we need to be familiar with. Number one is the spine of the scapula. So the spine of the scapula is kind of highlighted in red. In this picture specifically, it's really showing muscle attachment, but this whole structure in red is called the spine of the scapula. And this is on the back side. So what you're looking at is a posterior view of the scapula, of the shoulder blade. And you can feel this on your body very easily. Just kind of feel the back of your shoulder blade and go across. You'll feel this nice ridge. That's the spine. And we're going to have all sorts of different muscle attachments on it, above it, and below it. A lot of your rotator cuff is oriented right around this spine of the scapula. And the next bone marking we have is the glenoid cavity. It's also known as the glenoid fossa. And that's this kind of indentation or groove looking structure right here. And that is where the head of the humerus, the head of your upper arm bone, is going to actually fit in just a little bit. And here's your humerus right here. So these are the bones of the brachial region, or your upper arm. And we'll talk about some bone markings on the next slide. So several bone markings that you need to be aware of in the humerus. First, the easy one is the head. The head of the humerus is the most proximal part. So that's what's going to be fitting inside of that glenoid cavity or that glenoid process. Next, we have the epicondyles. And remember what epicondyles are. They're just processes for muscle attachment. So usually they're found just a little proximal to condyle-like structures. So the medial epicondyle is going to be these two bumps right here. So what you're looking at is this is an anterior view of the humerus, and this is a posterior view of the humerus. And how I knew that was medial was, one, the medial epicondyle is very prominent compared to the lateral epicondyle, but also if you look at the head always goes towards the medial aspect of the mid-sagittal line of the body. always. So whether we're talking about the head of the humerus, the head of the femur, it doesn't matter. The head always is oriented towards the midline. So because the head is on the medial side, anything on this side of the bone is going to be medial. Anything on this side of the bone will be medial as well. So the medial epicondyles, I'll try to just make it subtle. These big bumps in green for muscle attachment. The lateral epicondyles, same thing. They're just going to be on the opposite side. So we're going to have, it's going to be this area right here in orange would be the lateral epicondyles. And then we have these condyle-like structures in the humerus, but instead of calling them medial and lateral, we do have specific names. So we have the capitulum and the trochlea. And what's very, very important is to make sure you know which one is on the medial side and which one is on the lateral side. And once you learn the forearm bones in just a moment, that'll help you kind of get it straight in your head as well. So the capitulum bone, the capitulum, part of the humerus bone, what that is it is the lateral knob that articulates with the lateral bone, which is the radius. So I'll put an R there for radius. And where that's located is right here, this little knob that I'm highlighting in red. And you actually can't see it very well. Well, it would be right here, but it's kind of hidden with a posterior view. The trochlea is the medial bump, so that articulates with the medial bone, which is called the ulna. So that would be this bump here, right here in blue. And same thing, it is hidden. The ulna's in the way. But if we were to remove the ulna, it would be right around that area in blue. So those four structures, the epicondyles and the capitulum and trochlea, really, really close together. When you look at the lab pictures or the bones in lab, make sure you can distinguish the differences between these four structures. So moving distal down the upper extremity, we have the forearm bones, or the antebrachial bones. We call these the radius and ulna. The radius is always on the thumb side, so if we're standing in anatomical position, this is the lateral bone, and that's where we're going to have the capitulum, or where it's going to articulate with the capitulum of the humerus. And then the ulna is on the pinky side, or the medial aspect of the forearm, if we're standing in anatomical position, and that's what's going to articulate with that medial bump, that trochlea on the humerus. So taking a look at this picture, what you have is the ulna is the medial bone. So same thing, we're looking at a front view and a back view. So that would be the midline, that crooked line I just drew. So the bones with the U's, those are the ulnas, and then the bones on the outside here, those are the two radius bones. A couple bone markings that you need to be aware of. For the radius bone, we have the head, which is the most proximal looking thing, and it looks like a head. It's just kind of this rounded little structure like that, and then the rest of the bone just goes down. And then at the very, very distal end, at the very, very tip, we have this tiny little needle-like process called the styloid process. And remember, we've seen this before with the temporal bone, right? Right in front of your ear, you have this needle-like thing sticking out for muscle attachment. We call that the styloid process of the temporal bone. And it's no different here. We're going to have muscle attachment in the radius. We're just going to call it styloid process of the radius. When we move on to the ulna, there are three structures that we need you to know. Number one is called the olecranon process. So I'm going to show you this on the next slide, but I'm going to draw you a picture as well. I'm going to draw you a side shot of the ulna. Not the best picture, but okay. So the good way to remember the ulna is it always makes this U shape. If you look at, we're looking at a lateral view of the ulna, and what you're going to get is this nice U shape where the humerus can actually fit in. And what that's called is the semi-lunar notch. And the reason why they call it semi-lunar, lunar referring to moon, semi is just part moon, right? It's not a full moon. So we kind of get this crescent looking shape to it. This is also called the trochlear notch because it actually articulates with that trochlea part of the humerus. So semilunar notch, trochlear notch, same thing. Now the back of this, or the posterior aspect of this bump area right here, that would be the olecranon process. And basically, if you just flex your elbow and you feel the back of your elbow, the very pointy, bony part of your elbow, that's what you're touching. That's what you're feeling. It's the olecranon process of the ulna. And then last but not least, same thing as the radius, we have this tiny, tiny structure at the very, very distal end, very small needle-like process for muscle attachment, and it's also called the styloid process. So we'll call it the styloid process of the ulna. Okay, a little better picture here. To give you an idea, let's talk about the radius first. So this lateral bone, right here, this structure would be the head. And then if you go all the way down to the bottom, you'll see this tiny little point on the radius. And that little tiny needle-like point is going to be the styloid process of the radius. So those are the two bone markings we need to know for the radius. Let me clear this out, and then I'll show you the three bone markings that we just covered for the ulna. So what we're looking at here is, once again, this is an anterior view, and this is a posterior view of these two bones together. So this notch right here, where we have this groove or indentation, that is that semilunar notch, also known as the trochlear notch. You can look at the picture, and it's, in this picture it calls it the trochlear notch, and that's because it joins with the trochlea of the humerus. On the backside, the bump of your elbow, once again, is called the olecranon process. And then at the very, very distal part, right next to your wrist, you have these tiny little needle-like things that stick out barely, and that's called the styloid process of the ulna. So same thing, y'all. With these 2D pictures, you can make the differences, make out the differences. However, with a 3D bone, very easy to tell the differences between the trochlear notch and the olecranon process and the head and all those structures. So make sure you get your hands on some bones if you're taking a face-to-face class. All right, next are the carpal bones. The carpals are the wrist bones. We've talked about that before, day 1, chapter 1, right? So you have a total of 8 of them. Good news is you do not need to know the names of those 8, but these are just the bones located in this area. They're very small, short, cube-like bones for the most part. Connected to the carpals are the metacarpals. These are the bones that make up your hand, the palm of your hand and the back of your hand. And you have 5 of them, right? Because they're going to lead to your 5 fingers. And then last but not least, we have the phalanges, or your finger bones of the hand. Now, what I want to point out is that in each finger you have 3 phalanges, except for the thumb. Thumb's a little weird. So if we take a look at this pinky finger, what you have is you have 3 bones. You have that one, and then that one. So we name them based on their relationship regarding proximal and distal. So this first one would be the proximal phalange. The middle one is called the middle phalange. It's also known as the intermediate. Either one would be correct. Put middle. And then this last one would be the distal phalange. Now, if you notice in the thumb, we only have 2. So all we have is a proximal and a distal. There is no middle phalange on the thumb. So total, what you have is you have 3 on each finger. So 3, 3, 3, and 3. So 4 sets of 3 would be 12. And then 2 on the thumb. So you have a total of 14 phalanges in one hand. And then, of course, you have 14 on the other hand. So more than 10% of the bones in your body are simply just finger bones. And once again, we call them phalanges. we're going to see the exact same thing, the identical to this would be found in the toes. All right, we've covered the upper extremity. Let's move down to the lower extremities. First, we're going to introduce the coxal bone. The coxal bone is also known typically in layman's terms as the hip bone. We're going to be a little bit more specific. It's also known scientifically as os coxae, or os coxa being one. So it's a combination of three bones. Your hip bones, or your coxal bone, is a combination of three fused bones. We have the ilium bone, which is, we talked about the iliac crest a little bit ago when we were talking about some terminology. That's your kind of love handle bone area. You have your pubis bone, which is near your pubic area, genital area, and the front part of your hips. And then we have your ischium bone. Those are the bones you sit on when you're sitting on like a hard surface or sitting on the floor. And when you combine the two os coxae, so you have an os coxae on the left and an os coxae on the right, so they are connected in the front by that pubis area, but when you connect them with the sacrum and coccyx bones, what you get is this whole unit, and what we call that is the pelvic girdle. So remember, the shoulder girdle or the pectoral girdle was just two bones. It was the scapula and the clavicle that helped move your shoulder. The pelvic girdle, a little bit more complicated. We actually have a total of 8 bones. So we have ilium, ischium, pubis on the left and the right, and then we have sacrum and coccyx. So let's move on to the next picture, and I'll show you a more defined illustration of these 3 coxal bones. Well, I lied. Pictures on the next slide, coming up shortly. So once again, the os coxae, or the coxal bone, is made up of 3 bones all fused together, and you can see their names right here. And as I mentioned, the ilium is the uppermost, is kind of your love handle area. Ischium is the lowermost, so these are the bones that you sit on, at least on a hard surface. If you're sitting on like a couch or a pillow, you could be sitting more on like your sacrum or coccyx area. And then the pubis bone is just on the anterior front part. So there are going to be 2 important markings that you need to know with the os coxae. Number 1 is the actual hip socket. We've talked about this before. It's called the acetabulum. This is where that head of the femur is going to fit in to actually make your hip joint. So what the acetabulum is a combination of all 3 of these bones fused together. And then we have the pubic symphysis, or as you can see in your notes, it's also known as the symphysis pubis. You'll see it both ways. But that's basically an area where in the front part of the pelvis, the 2 pubic bones connect to one another. And this area can be stressed, especially during the childbirthing process and the female. So we need a really, really strong cartilage in this area. So this is one of those unique locations of the body where we find a lot of fibrocartilage. Remember, we have them inside of the meniscus of your knee. We also have it in the intervertebral discs between your spine. And then here we have it in the pubic symphysis, holding your 2 pubis bones together. So now let's go on to the next slide. I'll show you a picture of these 3 bones. There we go. Okay, so getting our orientation right. Both pictures are a picture of a right hip. So what we did was just pretend we had surgery and we're replacing your hip, and we removed the entire right hip area. And all we're doing is, on this picture on the left, we're looking at the lateral view. So you're looking at kind of from this angle. And then the picture on the right, you're looking at a medial view. So you're looking at the same hip, but you're looking at it from that perspective. So they're just going to look a little different. First, I want to show you the acetabulum. The acetabulum, once again, is the hip socket. So you can only see that from the lateral side because that's where the femur is going to be located. So that's this big fossa, if you will, indentation there. Now, once again, as you notice, it is a fusion of all 3 bones. We have the ilium I'll put IL for ilium here. We have the ischium in orange, and then we have the pubis in purple. And if you look at this hip socket area that I'll circle, what you'll notice is you get all three colors. You get a little of the tan ilium, you get the orange and the purple. All three bones make up this hip socket called the acetabulum. So what the next thing is going to be the pubic symphysis. I'll show you that hopefully on another picture, but the pubic symphysis is just a pad of fibrocartilage where the two pubic bones are held together. So here is the medial aspect of this pubic bone, and there's the medial aspect of this pubic bone. So holding these two things together is going to be this really, really strong, tough, collagenous fibrocartilage. So here we go, putting the whole pelvic girdle together. So now you have the os coxae on the right, os coxae on the left, because we're looking at an anterior to posterior view. And now since we have the sacrum and the coccyx, this is what we call the pelvic girdle. It's all connected. So to highlight the pubic symphysis, it's this area right here where the two pubis bones are connected. So it's a pad of very, very strong fibrocartilage. And then once again, in purple this time, you can see the acetabulum. These are the sockets where the femur heads are actually going to fit into to make your hip joint. Speaking of femurs, let's start working our way distally down the lower extremity. Femurs are the longest bones in the human body. They're also the largest bones in the human body. They're also the strongest bones in the human body. Certain parts of the femur are actually said to be stronger than steel itself regarding how much torsion and force they can handle. Very, very, very strong bones, and you have some very, very, very strong muscles in this area as well, the quads and the hamstrings that that are moving in this area. So very, very strong part of the human body. Few bone markings we want to point out. The head of the femur, as I've been mentioning, that's what actually fits inside of that acetabulum. So very similar to the head of the humerus. What I want to point out is, let's do the head in red. Once again, we're looking at an anterior view on this picture. We're looking at a posterior side on this picture. So the heads are medial. So therefore, anything on this side of the bone is going to be a medial blank, and then anything on this side of the bone, in purple, is going to be a lateral blank. So that'll help us with our orientation. Once again, getting inside the lab if you can, or playing with a digital atlas will greatly help you see the 3D structures of these bones. So next we have the neck. The neck is just what's connected to the head, just like in our body. So it'd be this area right here, very commonly fractured in the elderly as our bones start thinning and getting weaker. And then we have two very, very big processes, very big bumps that help us with muscle attachment, and they are called trochanters. And we have a very large bump called a greater trochanter and a not so large bump called a lesser trochanter. So you can see the greater trochanter on the anterior view right here in blue, big bump. You can also see it here on the posterior view. And then you can also make out the lesser trochanter right there, this bump. So once again, these bumps are for muscle attachment, very strong muscles. And then as we work our way distal towards the knee joint, we have similar structures that we've seen before. We have condyles and epicondyles. So condyles are the smooth surfaces that usually fit into some type of fossa, right? Make a joint. And then epicondyles are generally proximal to those, and those are used for muscle attachment. So a little harder to see in the femur, though. The humerus is a lot easier to make out the epicondyles, but we'll do our best. For the medial epicondyles, it's just these big protrusions right here at the very edge of the femur. For the lateral epicondyles, same thing. They're just going to be protrusions on the lateral aspect. right there. And then we have the condyles, and the medial condyle is obviously going to be on the medial side. So we'll do that in, let's just keep it consistent, orange. That's going to be the medial. And then the lateral condyles will be on the lateral side. And as you can see, the condyles are joining with that bone right below us, our shin bone, also known as the tibia. But before we get to the tibia, let's talk about our kneecap real quick. This is known as the patella bone. You're actually born without this bone. In that area, generally, it's just cartilage. And then as we age, start crawling, moving around, that cartilage does ossify and it becomes a bone known as the patella bone. Next, we have the two bones of our lower leg, the tibia and the fibula. A lot of students get those mixed up, tibia and fibula. So when we think about shin bone, tibia is typically the big shin bone. It's really easy to feel. Just feel the front of your lower leg. You're feeling the anterior crest or anterior border of the tibia. The key thing to always understand, to make sure you don't get this confused in lab, is the tibia is always the more medial one. If you remember that, you're good. No test question is going to trip you up. And since the tibia is more medial, therefore the fibula by default has to be more lateral. So what we're looking at in this picture, same thing. We have an anterior view on the left. We have a posterior view of the two bones on the right. So this bigger bone, that's medial, is the tibia bone. And then the really, really long, skinny bone on the lateral side, that is the fibula. So let's move on to the next slides and talk about some bone markings for these two bones. First, let's begin with tibia. Now, what I've been telling you since the beginning of this chapter is, generally speaking, and I say the word generally and I say the word typically a lot, mainly because there are weird exceptions throughout the human body. So it's not always 100% this is 2 + 2 = 4. Sometimes 2 + 2 = 4.5. And this is one of those weird situations where I've been telling you for the longest time, a condyle is a smooth bump or a rounded surface of a bone that fits inside of a groove called a fossa, right? And we've seen that in multiple examples. We've seen that with the mandibular condyle and the mandibular fossa. We saw that with the occipital condyles and that kind of groove in that first cervical vertebra, the atlas bone. This is one of those weird exceptions. So on a couple slides ago, we just talked about the condyles of the femur, the medial and lateral condyles. And what you would think is it fits inside of a fossa on the tibia, and that's not really the case. We have two condyles in the tibia as well, or on the tibia as well. We have a medial condyle, which is this area right here in purple. And then we have a lateral condyle in this area in green. Now we do have this top portion called the tibial plateau, but notice it's a plateau, it's flat. So there's not really that big of an indentation, and that's what gives our knee it gives us freedom to run and to put a lot of weight on our knee. But it also gives us some liability and susceptibility to injury. Because if that femur bone, let me draw it for us, if that femur bone with those big old condyles slips off of that tibia, you are tearing every single ligament that you have, and you possibly have a dislocated knee, which is going to be absurdly painful. So one of those weird exceptions here, the tibias on the femur articulate with the condyles of the femur, if that's what I was trying to say, the condyles of the femur articulate with the condyles of the tibia. Weird exception. The next important bone marking that you need to know is something called the tibial tuberosity. We've actually highlighted this before. We're learning about T words, right? Trochanters, tubercles, tuberosities. They're all big T words. And all they are just processes for muscle attachment. I talked about soccer players having a really large tibial tuberosity because those muscles, tendons are just pulling on that bone, making that bump really big. And It's located right there. And then if you go all the way down to the bottom or the distal end, what we have is the ankle area, the ankle joint. Now, what I want you to do is, as you're listening to this video, feel your ankle. Feel both sides of your ankle. And what you'll feel is you'll feel on the medial side you have this ball-like structure, and on the lateral side you have this ball-like structure. On the medial side, the medial ball-like structure, what that is a big thing sticking out of your tibia bone. And that is called the medial malleolus. Now, it's only on the medial side because it's only found on the tibia. So that bone on the that bump, or that circular looking thing on the medial side of your ankle, that is your tibia. And specifically, it's the medial malleolus of the tibia. On the lateral side, it's a completely different bone. That is your fibula, and what we're going to call that is the lateral malleolus. So those two bumps are thanks to two different bones, tibia on the medial side, fibula on the lateral side. So you only have a medial malleolus on the tibia. When looking at the fibula, as I just mentioned, you can only feel a lateral malleolus. There's no such thing as a medial malleolus of a fibula. It's the lateral bone, so therefore it only has a lateral malleolus. And then one other structure we want to point out is the head of the fibula. That's the proximal part right here that actually articulates with that lateral aspect of the tibia. Okay, so we've talked about carpals before. Carpals are the bones of your wrist, and therefore tarsals are the bones of your ankle region. So we have a total of 7 tarsals. We're going to highlight 2 of them that we absolutely want you to know. But similar to the wrist, right? We said the wrist has 8 bones, and just know that those are called carpals. Same thing here. Your tarsals have 7 bones, and we don't need you to know all 7, but we do need you to know the 2, and they're not more important than the other ones, but they're 2 very easily recognizable bones. How about that? So those 2 recognizable bones are the calcaneus and the talus bone. So the calcaneus is also known as your heel bone. That's the kind of gold yellowish bone in the picture. And the talus bone is what actually your tibia and fibula articulate with, this purple bone. So the lateral malleolus of the fibula and the medial malleolus of the tibia actually anchor or touch this talus bone. So what we have is we have a medial malleolus and a lateral malleolus, and then we have a bone anchoring them. That is your ankle. So it's the talus and then the ends of the tibia and fibula that makes your ankle actually be able to move. Similar to the hand. In the hand, we called them metacarpals, right? Instead, here we're going to call them metatarsals. These are the 5 bones that make up the long portion or the arch of your foot, or just really the top of your foot. And we have 5 of them because we have 5 toes, hopefully on each foot, right? And exactly similar to the fingers, we're going to call these toes phalanges. And it's the exact same anatomy. So here on this side, we're looking at the big toe. So all we have is we have a proximal phalange and a distal phalange, and that's it. But all the other ones have 3. And I'll try to highlight that for you. Let's look at the second toe. You got 1, and then you have 2. I'll just put a dot there so you can see them, and then the third one. 1, 2, 3, 1, 2, 3. Pinky toe really small, but there are still 3 bones. So we have a proximal bone. Remember, the middle one's either called the middle bone or the intermediate bone, and then the distal bone, and more specifically phalange. So proximal phalange, middle or intermediate phalange, distal phalange. Okay, that is it. You have now covered all 206 bones of the human skeleton. These last 4 slides, what I want to do is just go over some differences between the hands and feet and then we'll talk about the male-female pelvis specifically, and then we will wrap up this skeletal chapter. So hands and feet, as you just saw, I just sped right through the tarsals, metatarsals, and phalanges. And the reason why is because anatomically, they're pretty much the exact same thing, right? We have 8 carpals and 7 tarsals. Okay, a little difference there. But regardless, we have 5 metacarpals in the hand, 5 metacarpals in the feet. And we should have a total of 14 phalanges in each hand and 14 phalanges in each foot, right? And the reason why it's not 15 is because that big toe or that thumb only has 2. So anatomy-wise or structurally speaking, it's the exact same thing. From a functional standpoint, though, we want you to know that your hands and feet are not the same, right? Your hands, major function of your hands is a manipulation of things such as manipulating a pen or typing on a keyboard or a cell phone. Other things, grasping and holding on to things, carrying things. And your thumb is very opposable. And what that means is you can move and touch the tips of your fingers to your thumb. And it's because the joint that joins your wrist and your metacarpal of your thumb, it's very, very different than any other joint in the entire human body. And we're going to cover that next chapter. But you can't do that in your feet. You can't touch the tips of your pinky toe to your big toe. You can't, your toes don't move that way, right? So functionally, they're very, very different. The main purpose of your feet is to be very, very strong for support, right? We're constantly walking on them, standing on them, running on them, going up and down stairs on them. So very similar to the spine. Remember, we had curves in our spine. We had those convex and concave, or those kyphotic and lordotic curves in our spine to kind of dissipate the weight, or at least spread out the weight, in other words. Same thing in the foot. We're going to have arches in your feet so we can kind of spread out those forces so we don't have arthritis and damage to our feet. So let's go on to the next slide and I'll show you what those arches look like. So the arches are simply just made up of really strong tendons and ligaments on the bottom of your foot. And once again, they provide support. So we can stand, if I weigh 200 pounds, I can stand on both legs and put pretty much all 200 pounds on my knees and on my feet, right? And hopefully I'm not in pain by doing that. So the 3 arches that you need to know, and this is an awesome illustration from Wikipedia right here showing you these 3 arches. You have a medial arch. I'll do this in black. You can see this triangle. So there's a medial arch aspect on the medial side of your foot. You can see this big toe, medial side. And then on the opposite side, on the lateral aspect, you also have a lateral arch. Generally not as prominent as the medial arch, but still, it's still there. This will be on the lateral side, pinky toe side. And then we have a transverse arch going across the foot. And the combination of these 3 arches give your foot enough support to support the rest of your body weight. So you can walk, run, jog, do all the things you like to do, hopefully without having compromise to your foot structure. Yeah. The last topic that we need to cover for this chapter is just some differences between the male and female skeleton. First difference is, generally speaking, guys are a little larger than females. If you take the average male, there's 3.5 billion of them on Earth. If you take the average male versus the average female, the other 3.5 billion of people on Earth, generally speaking, guys are a little larger than girls. Now, one of the main reasons is because of, we talked a little bit about this in Chapter 6 with the hormone change. Once females hit menopause in older age, they have a harder time maintaining strong bone density. So they have to possibly work a little harder in the gym to make sure their bones are strong. So that's one difference. The second difference I want to point out are the differences in the male pelvis versus the female pelvis. So if you take a look at the shape, and I'll have a picture on the next slide, male pelvises are generally a lot more narrower, where female pelvises are more spread out. And the reason why is, if you take a look at this bottom bullet point, it's because females have well, I'll let you choose either the blessing or the curse of having children. So if they are having a natural birth and they're pushing a baby out of that area, out of their hips, their pelvic area, they need a little bit more space, right? And then they have to push it through the cervix and the vaginal canal. So it's a little more spread out in that area. But also the angle of the pubic arch, which is basically this imaginary angle measuring underneath the two pubis bones where they meet. So let's move on to the next picture and I'll show you the difference. With the pubic arch, the females are going to have a much larger angle. So what we're looking at in this picture is the female pelvis on the left and the male pelvis on the right. And what you'll notice is the female pelvis just has a little bit more room. Although it's more shallow, it's more spread out from lateral to medial. So there's more room in this circular area to pass a child through. Versus the male pelvis, yes, it's deep, but it's very narrow from a lateral to medial perspective. And then the last difference was that pubic angle. If you take a look at the pubis area, so here we have our pubic symphysis holding the two pubis bones together. In males, when you draw this angle that connect the underneath or the underside to the pubic bones, you get this kind of smaller angle, this acute angle, where in females, it's just a little more spread out, a little wider. And that just shows you that the hips are indeed wider, if you don't believe me, in the female pelvis. So those are the big differences. Make sure that you study this material. You should know all 206 bones in the body for lecture and lab. You should also know all of the specific bone markings that we talked about today for lecture and lab. And make sure you let your instructor know if you have any questions, and I will see you next time for the joints chapter.